Today we're discussing the assessment and management of patients with eye and vision disorders. Our learning objectives are: identify the major structures and the function of the eye, specify assessment and diagnostic findings used in the evaluation of ocular disorders, describe assessment and management strategies for patients with low vision and blindness, list the pharmacologic actions in nursing management of common ophthalmic medications, recognize the clinical features, assessment, and diagnostic findings in medical or surgical management of glaucoma, cataracts, and other ocular disorders. Explain the nursing management of patients with glaucoma, cataracts, and ocular trauma, and discuss general discharge education for patients after ocular surgery. Let's begin part 1. Please review and be familiar with the external structures of the eye. Please review and be familiar with the extraocular muscles and their function. Review and be familiar with visual pathways and effects of defects on vision. Be familiar with the structure of the optic nerve and retina. Vision assessment begins with taking an ocular history and assessment of visual acuity. Nurses must be familiar with assessment of visual acuity in any setting. Acuity is expressed for each eye individually. OD for right eye and OS for left eye. Normal vision is expressed in the fraction 20/20. Assessment of the eye should begin with observation of the external structures and progress systematically. Assessment of pupillary response, extraocular movements, gaze, and eye position provide valuable neurological information. Diagnostic evaluation may be warranted. The nurse should provide patient education regarding what to expect, the purpose of testing, and the side effects of testing. Diagnostic testing may reveal underlying causes of visual problems as well as monitor the progression of disease process. Refractive errors may be very slight to severe and result in impaired vision and loss of function. Eye shape determines visual acuity in refractive errors. Low vision and blindness define visual impairment and allow individuals with these findings to receive assistance through governmental disability programs. Assessment of low vision begins with an accurate and thorough health history. It is vital to include assessment of functional ability, as well as coping and adaptation emotionally, physically, and socially. Management of low vision includes assistive devices to improve vision as much as possible. Consistent practices, such as the placement of items in living areas and the clock method for trays, allow independence and adaptation. Patient and family education should support coping, grief, and loss regarding diagnosis. Referral to community resources and occupational therapies may increase independent function of patients. Communication, support, and service animals may also increase the functional independence of persons with low vision. Medication applied to the eye has limited absorption due to the structure of the eye and medication properties. The natural barriers of the eye can prevent medication absorption. Conditions may require intraocular injection or systemic medications. Topical medications are often the first line of treatment due to limited side effects and ease of administration. Nurses must be familiar with ophthalmic medications. Nurses must know the indications for usage, proper administration, and side effects of ophthalmic medications and be able to provide accurate patient education. Glaucoma is a group of ocular conditions in which damage to the optic nerve is related to increased intraocular pressure caused by congestion of aqueous humor in the eye. It is estimated that 3 million Americans have glaucoma and approximately 50% are undiagnosed. Prevalence of glaucoma increases after age 40. Glaucoma has no cure but may be controlled. See chart 63-5 for a review of risk factors. Glaucoma is an alteration in the normal outflow of aqueous humor. When production of aqueous humor and drainage are not in balance, pressure builds up. This is referred to as increased intraocular pressure. This increase in pressure damages tissues of the retina and causes ischemia to the optic nerve. Glaucoma is classified based on the mechanism of impaired outflow, association with other conditions, and is either congenital, primary, or secondary. Review Table 63-4 for the two most common adult types of glaucoma, wide and narrow angle. Glaucoma is often called the silent thief of sight, as many patients are unaware of their diagnosis until they note vision loss or changes. Patients may also have aching eyes and headaches. Diagnostic testing establishes the category of glaucoma, extent of optic nerve damage, and formulation of a treatment plan. Use of tonometry to assess intraocular pressure and ophthalmoscopy to inspect optic nerve disc and visual testing rule out other ocular diseases. The goal of glaucoma treatment is to prevent progression of optic nerve damage resulting in vision loss. This is accomplished by maintaining intraocular pressure, medications, laser procedures, and surgery as indicated. Nurses must be familiar with medications used to treat glaucoma and their side effects. See Table 63-5. This table reviews medications used to manage glaucoma. These medications may produce systemic side effects, and patients must be informed to increase compliance of the treatment plan. Nursing management of glaucoma is focused on promoting adherence to the treatment regimen to preserve vision and stop disease progression. Self-care and patient knowledge of treatment plan is vital to the successful management, as there is no cure for glaucoma. Medication teaching is important to increase compliance. Support for patients adjusting to vision loss is vital.